Good morning, everyone. I'm Barbara Boyer, the Executive Director of AgeWise Colorado, and I want to welcome you to this morning's webinar about diabetes. It will be presented by the Adams County Department of Health, and they have a very special program, which is diabetes education and prevention. I'm going to spend just a minute or two sharing my screen. Give me 1 second here, please. Share. Okay, can everyone see this? I'm hoping so. This is in this series of our webinars. We do 1 or 2 every month, hoping to provide you with more information that you need and education about issues that you may not have known about. And I can't move this. There we go. If you would, we would greatly appreciate it if you would mute your sound and turn off your video. We are recording this so that we can post it on our website so others can see it at their leisure. We do encourage questions and we ask you to put them in the chat, and we'll relay them to our presenter. So you know, in case you don't, AgeWise is providing a very essential service of connecting you to providers like this program on diabetes. We are a 501c3 nonprofit, so anyone who's willing to make even the smallest of donations, we greatly appreciate. We also are forever looking for volunteers. We have lots of work to do and we can use help. This is, of course, the homepage of our website. It is very easy to navigate. And with that, I will stop my share and introduce Maritza Orozco Reyes. I hope I pronounced that correctly, Maritza. The floor is yours.
Thank you, Barbara. Yeah, and it's Maritza, like the Ritz cracker. So it's an easy way to remember that. Yeah. Let me share my screen now. 1 minute. There we go. Perfect. So good morning and welcome everybody. Once again, my name is Maritza Orozco Reyes, and I'm a registered dietitian, also diabetes educator with Adams County. And today we're going to be talking about a little bit about understanding diabetes. But before we dive in, I want to talk to you a little bit about me. So I've been in public health for about 9 years now. I'm a registered dietitian, currently pursuing my certification as a diabetes care and education specialist. I'm passionate about educating priority populations to help improve health outcomes. And when I'm not in the office, I love to bake. I like going hiking and camping with my kids and my dogs, and I enjoy some cozy reading time with my girls. So our objectives for today, we're going to discuss or describe what diabetes is and how it is diagnosed, give an overview of the different types of diabetes, discuss some complications of uncontrolled diabetes, discuss diabetes management with healthy eating, staying active, medications, and monitoring, and also encourage the reducing the risk for diabetes. And we're here today as it is Diabetes Awareness Month. It is a time to learn how to prevent, manage diabetes, and to show support for people who have the disease. And before I get started, I wanted to give you a quick rundown on some national statistics from the Centers for Disease and Control and Prevention Agency, or better known as the CDC. More than 37 million people in the United States have diabetes, and 1 in 5 don't know they have it. 96 million US adults, over a third, have prediabetes, and more than 8 in 10 of them don't even know they have it. And so diabetes is an 8th leading cause of death in the United States, and that may be underreported. And medical costs for people with diabetes are twice as high as for people who don't have the disease. And this is why it's important to have this awareness. And to everybody who's joining me here today, I know if I were to ask you, what does diabetes mean or what is diabetes, I'm going to have different answers. So please feel free to unmute yourself or add them to the chat and let me know what your definition of diabetes is. So, the definition of diabetes. It is a chronic, long-lasting health condition that occurs when the body cannot produce enough insulin or cannot effectively use the insulin it does produce. Or another way of saying it is how your body turns food into energy. So, your body breaks down most of the food you eat into sugar or glucose, then releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin is a hormone that acts like a key to let your blood sugar into the body cells for use as energy. With diabetes, your body doesn't make enough insulin or it can't use it as well as it should. So, when there isn't enough insulin or cells stop responding to insulin, also known as insulin resistance, too much blood sugar stays in your bloodstream. And that is the issue. That is what diabetes is. It's too much sugar in the bloodstream and not inside the cells. And over time, this can cause serious health problems such as heart disease, vision loss, and kidney disease. There are three main types of diabetes. Type 1 diabetes, this is an autoimmune condition where the body's immune system attacks insulin producing cells in the pancreas, and it typically develops in children and young adults, but it can occur at any age. Type 2 diabetes is more common and is usually develops in adults. It occurs when the body becomes resistant to insulin or when the pancreas doesn't produce enough insulin. Lifestyle factors such as an unbalanced diet, inactivity play a significant role in its development. And then thirdly, we have gestational diabetes. This is a type of diabetes that develops during pregnancy. It occurs when the body cannot produce enough insulin to meet the increased demands during pregnancy, leading to elevated sugar levels. And this typically arises in the second or third trimester and usually resolves after childbirth. Now, they can all lead to high blood sugars, which can cause various health issues if not managed properly. So, managing diabetes involves monitoring your blood sugar, making dietary changes, increasing physical activity, and in some cases, taking medication or insulin. And lastly, I have started here prediabetes or dysglycemia. This is a health condition where blood sugars level are higher than normal, but not enough to be classified as diabetes. And this is often considered a warning sign that you may be at risk of developing diabetes in the future. So, how is diabetes diagnosed? The diagnosis of type 1 and type 2 generally involves the same blood tests, but there are key differences in how they are approached and interpreted based on clinical presentation and other factors. But for the presentation today, we are definitely focusing on type 2 diabetes. And so in the clinic, they'll use something that's called the hemoglobin A1C for the diagnosis of type 2 diabetes. For pregnancy and some other instances, they might use a glucola to diagnose diabetes. And so if you see here, our normal A1C would be less than 5.7 or 5.7 or lower. For prediabetes or dysglycemia, it's going to be a 5.7 or 6.4%. And to have a diagnosis of diabetes, it's going to be 6.5% or above. And then we also have something that's called a fasting blood sugar test and the glucose tolerance test. These are going to be a little bit more involved when being diagnosed in your doctor's office. So definitely make sure that you are getting the correct diagnosis and asking them how they're diagnosing that. And so, what puts you at risk for prediabetes? Some of these are risk factors: being overweight, are 45 years or older, have a parent or brother or sister with type 2 diabetes, are physically active less than 3 times a week, have ever had gestational diabetes, or give birth to a baby who weighed over 9 pounds, and certain uh, African American, Hispanic, Latino, American Indian, or Alaskan Native persons, some Pacific Islanders and Asian Americans, people are also at higher risk of developing diabetes. And so there's this really cool tool that's called the prediabetes risk test that you can take. You can go onto the CDC website or even our webpage and see if you're at risk. If you score a 5 or higher on this test, you're at high risk. And the good news is that we can help with that. we have a program that's it's aiding in reversing type prediabetes and or delaying the onset of type 2 diabetes, and it's called Journey to Wellness. You're feel free to scan the QR code, and you can find more information about those programs on our website. So like I said, our presentation is really being focused on type 2 diabetes. And type 2 diabetes is a chronic condition that affects the way your body metabolizes or uses sugar for energy. In type 2 diabetes, the body becomes resistant to insulin or does not use it effectively. Over time, the pancreas may also produce less insulin. Some key features for diabetes is insulin resistance. So the body is not able to respond effectively to insulin, making it harder for glucose to enter the cells. Some of those risk factors are the same risk factors as we saw in the previous slide with prediabetes. Symptoms can develop gradually and may include increased thirst, frequent urination, fatigue, blurred vision, and slow healing sores. And some people may not have any of these symptoms at all. So once again, it is very important to get these tests done at your provider's office. And it can often be managed with lifestyle changes such as healthy diet, regular exercise, and weight management. And in some cases, oral medications or insulin therapy may be required. Some complications of not managing type 2 diabetes can lead to serious health complications, including heart disease, kidney damage, nerve damage, and vision problems. So early diagnosis and management are key to preventing complications and maintaining an overall health. And so why do we care so much about diabetes? Well, if left untreated, it can lead to many other complications like heart disease and stroke. People with diabetes have an increased risk for heart attack, stroke, and complications related to poor circulation. Eye complications. Diabetes can cause eye problems and may lead to blindness. Kidney disease. It can damage the kidneys, which can cause them to fail and lose their ability to filter waste from the blood. Sexual dysfunction for some people, for both men and women. Diabetes can have an impact on sexual health. Diabetes can cause nerve damage that can lead to erectile dysfunction for some men. Nerve damage, diabetes, it can cause damages to nerves that run throughout the body, including nerves to the spinal cord, muscles, skin, blood vessels, and other organs. We also have foot complications. So foot problems most often happen where there's a nerve damage in the feet, poor blood flow to the feet, or both. Skin complications, depression, and feeling down once in a while is normal, but for some people, a feeling of sadness just won't go away, and life for them seems helpless. So feeling this way most of the day for more than 2 weeks is a serious sign of depression. And then people also get gum disease when plaque destroys the gums and bone around the teeth. People with diabetes can get gum disease from having high blood sugar levels for a long time. And many people who don't take care of their diabetes and don't perform regular care in their mouth and see their dentist can get gum disease. And so managing diabetes is a balance between factors that lower your blood sugar, such as medications and exercise, and those that raise blood sugar, such as stress and hormones. With that being said, we will now shift our conversation to a hot topic, which is nutrition with diabetes. So, what have you guys heard about carbohydrates as it relates to diabetes? Feel free to mute yourself or type it in the chat. Okay. So we'll start with what are carbohydrates. Carbohydrate is a macronutrient. Macronutrient is a type of nutrient that is required by the body in large amounts to provide energy and support overall health. The three primary macronutrients are carbohydrates, protein, and fat. So with carbohydrates, it's the body's preferred fuel source. Why? Because carbs are broken down into sugar, which is used by the body's cells for energy, and they're found in foods like grains, fruits, vegetables, and legumes. Then we have something that's called protein, which is essential for growth, tissue repair, immune function, and the production of enzymes and hormones. Proteins are made up of amino acids, and good sources include meat, fish, eggs, dairy, and beans, and nuts. And then we have fats. These provide a long-term energy. They help absorb certain vitamins and are vital to brain function and cell structure. And fats are found in oils, butters, avocados, nuts, seeds, and fatty fish. And I like this picture here of these carbohydrates if you think of it as a family tree. So we have the parents, it's called the carbohydrate. And then we have, or this is, the family name, and then the parents, simple carbohydrate and complex carbohydrates. And then we have the kids, sugars, starches, and fibers. I think as this is the first kid, the fiber, who's really well behaved and listens. And then we have maybe the second kid, which are the starches, which does raise your blood sugar a little bit, but not as much as these simple carbohydrates over here, which definitely break down a lot quicker, which gives you that spike in blood sugar. And so these are the types of complex carbohydrates that we want to focus on: the fibers, some of the starches, and definitely limit the simple sugars. And fruit is considered simple sugar, but it also has fiber, vitamins, and minerals. So I definitely encourage you guys to still continue eating those fruits. And also, dairy products have natural sugars in them, which are considered a simple carbohydrate. And then we can definitely discuss that more later on in those classes. We'll go into details. And so, why our bodies need fiber? Or carbs. Carbs, once again, are the body's primary fuel source. It promotes bowel health, and other health benefits is one, it reduces risk obesity and maintains your blood sugar levels, and definitely helps reduce the absorption of cholesterol. And this is an example of like what we would be discussing in some of our classes about what my healthy plate looks like. Definitely making half of your plate those high fiber vegetables or non-starchy vegetables. A fourth of your plate would be the starches, and then a fourth of plate your protein. And this is kind of what we were discussing, where we said you want those macronutrients. So this is where it would play into it. And physical activity is crucial for people with diabetes. Regular exercise offers numerous benefits, both in managing blood sugar levels and improving overall health. And here's a list of some of the benefits of activity. It lowers blood glucose and blood pressure. It improves the body's ability to use insulin. It promotes weight loss. It boosts mood and mental health. And it lowers the risk for heart disease and stroke. There's many organizations like the World Health Organization, Centers for Disease Control and Prevention, the American Heart Association, the American Diabetes Association that all recommend of 150 minutes a week of moderate intensity activity. And this guidance based on evidence showing that regular physical activity of this duration helps improve overall health, reduces the risk of chronic disease such as heart disease, diabetes, and obesity, and improve mental health and longevity. So what if you're not meeting those 150 minutes currently? That's okay. If you're not close to that, we want you to start small. So small goals over time add up. Give yourself an extra 5 minutes every other day and see where that takes you. For example, if you're currently taking a 30-minute walk, add 35 minutes every other day. See what happens. If you use the stairs instead of the elevator, park further away at school or at the store, walk your children to school. So these are some things that you can do in your daily activity that will increase those minutes. Also, some aerobic activity or weight bearing. Go choose something that's fun like dancing or Zumba. Also, consider low cost resources like silver sneakers at the rec center. And so, the ABCs for diabetes are indicators for managing diabetes and reducing the risk of complications. Monitoring and controlling these factors can help people with diabetes live healthier lives and prevent or delay serious complications like heart disease, stroke, kidney disease, and nerve damage. Okay, so let's get into what the ABCs are. A is for a hemoglobin A1C. This is an average of your blood sugar levels over the past 2 to 3 months. And A1C is reported as a percent, and an estimated average glucose, or an EAC, is another way to report this A1C, but uses units per milligrams per deciliter, and would be the same thing as if you're poking your finger. But why is it important? So the A1C is a primary tool for assessing how well diabetes is being managed. A high A1C level indicates that blood sugar has been consistently high, which increases the risk of diabetes-related complications. The goal for many people with diabetes with an A1C level below 7%, but individual targets may vary depending on person's health condition and treatment plan. And so what does the A1C really tell us? Higher A1C means more blood sugar is circulating in the blood, which can damage blood vessels and organs over time. And this is why it's important to maintain that percentage on the lower end. B. B is for monitoring blood sugar. All right, blood pressure, I apologize. High blood pressure makes your heart work harder, right? And so it's important because people with diabetes that are high risk for high blood pressure, which increases the risk of heart disease, stroke, kidney damage, and eye problems. The goal for most people with diabetes is to keep their blood pressure below 140 and 90 milligrams mercury, milligrams per mercury, or lower, depending on the individual health factors. But people with diabetes should determine individual blood pressure targets with their healthcare provider. And so, what does high blood pressure tells you? Well, high blood pressure, if uncontrolled, can cause damage to the blood vessels, increasing complications. And I'm not sure if you guys are catching a theme here. When I'm saying heart problems, kidney problems, vision, a lot of these things are microvascular complications. And we'll get into that in a little bit more. And the C for ABC, we have cholesterol. Cholesterol is a fat-like substance in the blood, and there are different types, but the key ones are LDL, which is often referred to as a bad cholesterol because of high levels that can lead to the buildup of plaque in arteries, increasing the risk of heart disease and stroke. HDL, which is the good cholesterol because it removes the LDL cholesterol from the bloodstream. And then we have triglycerides. This is a type of fat found in the blood that, when elevated, can also increase the risk of heart disease. And so, why is it important? People with diabetes, particularly type 2 diabetes, often have abnormal cholesterol levels. Elevated LDL and triglycerides combined with a low HDL levels increase the risk of cardiovascular complications. And so the goal with diabetes is to maintain LDL levels under 100 milligrams per deciliter, HDL levels above 40 to 50, depending if you're a man or a woman, and triglycerides below 150. And what it tells you. So, if uncontrolled cholesterol levels lead to atherosclerosis, which is narrowing and hardening of the arteries, which increases, once again, the risk of heart attack, stroke, and other cardiovascular issues. So, another question for you guys. True or false? Taking medications will cure diabetes. That will be false. It doesn't cure, but it does help manage. Okay. And so different medications act on different parts of the body. Some medications can work on one or more organs to help aid in blood glucose control. So it's very important to know what type of medication you're on and what they're doing to help you maintain your blood sugars. Diabetes affects 8 different organs in the body. And so there's pretty much medication for every type of those organs. And we can get into that more specifically during our classes where we learn more about the physiology of diabetes. And so let's reduce the risk, right? Reducing the risk of developing diabetes, particularly type 2, involves adapting a healthy lifestyle that includes management factors like weight, diet, physical activity, and other habits that influence insulin sensitivity and blood sugar levels. Here are several effective strategies for you to reduce your risk. One would be to lose 5 to 10% of your total body weight. Okay, exercise about 150 minutes a week. Make up half of your plate with non-starchy vegetables. So remember that high fiber foods. Improve your ABCs. And definitely, if you are smoking, think about quitting because smoking increases the risk for these complications. It interferes with your blood sugar control. People with diabetes already face 2 to 3 times risk for heart problems. And so if you're smoking, this increases also your cholesterol levels, damages and constricts blood vessels, increases risk of kidney or nerve problems, and increases, once again, blood pressure. So once again, good news is that we do have a program to aid in achieving your blood glucose goals, and we dive deeper into the topics I briefly mentioned here. These are the reference I used for our presentation today. And if you have any questions, here's my contact information. Feel free to email me, text me, call me. I'm available. Thank you.
Thanks. That's pretty comprehensive in a very short amount of time. There's a couple of questions when you're talking about when you showed the plate. Is that the Mediterranean type diet? Do
It's
you know?
not the Mediterranean type diet. No, it is just making sure you're balancing your carbohydrate with your fiber and your protein and fats.
Okay. Another
Sim-
question is, could you repeat where someone could find that chart, that test, that pre-diabetic test?
So I can go ahead and share my presentation with you, Barbara, and you can find it there. You can scan the QR code, or our website will have that link to that test.
Okay.
So
And since we're recording this for anyone that's watching, if you missed that, and scanning the QR code, you can go back to the our website and see that, or go to your website, correct?
correct. And then let me just give you the website on here really quick. That is going to be adamscountyhealthdepartment.org.
Great.
Mm-hmm.
And one other question, because we're always talking with older adults and trying to help them. So as you age, is it just a normal function for your body to produce less insulin?
Yes, this is why that age factor is risk of 45 years or older. And actually, I think that has gone down to 35 years of age. But it's because your beta cells, these cells that are being made in your pancreas, are slowly dying off.
So
Yes.
all of us who are a little bit older should be a
Mhm.
little bit more careful with our diet and exercise.
Exactly. And those are really the pillars of managing diabetes. And this is why also as, we age, it's gets harder and harder to manage diabetes.
Wonderful.
Yeah.
Nope, there are no more questions. Again, you can find this on our website probably within a week. And I want to thank you, Maritza, for it's just a great presentation and we appreciate the knowledge you've shared with
Absolutely.
us. Um,
Thank you for having me.
last chance, any other questions? No, I don't see any. So thank you so much. Have a great afternoon, everyone, and we'll see you next time. Take
Bye.
care. Bye.